Hi everyone, I'm Jody Schwan with Sioux Falls Business. Thanks to all of you who have joined us this week for our series of videos. We're very excited about the one we have today. There's probably never been a more appropriate time to mark National Nurses Week, but this is it. There's lots to talk about, and we are learning more about the nursing profession, how our nurses are doing, and what might be ahead for them from Meghan Goldammer. She's the Chief Nursing Officer with Sanford Health. Hi Meghan, thanks for being with me today.
Hi, Jody. Thanks for having me.
Well, I feel like there's a lot to talk about. There would be anyway, even if it were not Nurses Week. But since it is, I was impressed to learn that across the Sanford organization, there are about 11,000 nurses. So your job involves a wide spectrum of people. And this is a broad question, but in this unprecedented time, how is your workforce doing? How are the nurses holding up? What are you hearing from them, seeing from them as we mark Nurses Week?
Well, thanks for recognizing Nurses Week. It is a big week for nursing, but a different week for us, that's for sure. We're used to celebrating this week, having large gatherings. We usually fill up big spaces and have large recognition events, potlucks, educational opportunities, and speakers coming in for our nurses. So this is a different Nurses Week with social distancing and just with everything going on with COVID-19. So we hope that we'll be able to reschedule a lot of what Nurses Week looks like, but we have a lot of things we're trying to do still during the COVID-19 times. So our nurses overall are doing great. I couldn't be more proud to be a Sanford nurse right now. They've really stepped up and leaned in, and not just at work, but also at home with their families, having to take care of kids being at home with homeschooling. They've stepped up in their local communities as well. So our nurses have risen to the occasion, that's for sure.
I feel like depending on where they sit within the organization, these last 2 months or so have been decidedly different. I think our minds go to those frontline nurses who are face to face with the COVID-19 patients. And my guess is that's a small fraction of your workforce. You've got others who are in totally different roles. You have some who maybe don't even unfortunately have as much to do right now. How are you navigating through all of those various needs throughout your different nurses?
Right. Well, predominantly, the majority of our nurses are frontline caregivers, but like you mentioned, with our clinics and healthcare kind of taking a pause there for a while, we've had the opportunity to use a lot of those nurses, and they've really rose their hand and said they want to help out in other ways. As we were preparing for COVID-19, really over the past 50 days or so, we knew we were going to need an increase in clinical support in our hospitals. So we took the opportunity with some of our nursing staff in other areas that don't work specifically in the hospital to do some upskilling and cross-training work. We did that across clinical and non-clinical teams, quite honestly. And it was just amazing to see the people that stepped forward that wanted to help and do different jobs than they're used to typically doing. We had over 47 different tracks of cross training and upskilling that you could participate in. And at the end of this week, I think we'll have over 4,000 people that have some additional level of training to help if we need it. That doesn't look like it's going to be the case here going into the future, but I'm really happy that we're prepared and that our staff was more than willing to step up and help out. It was great to see.
That's impressive. 4,000 people who have gone in a really relatively short amount of time. And as you said, I know, fortunately, it's not like the hospitals have been overwhelmed with patients yet, but we don't know what the rest of the year will bring. There's a lot of uncertainty, obviously, around this whole thing. So I think that extra training certainly could not have hurt. Are there some things that you're doing to just support the overall well-being of your nursing community? I think you touched on it great, but there's a lot of change hitting this workforce all at the same time, both at work and at home.
Yeah, I agree. I mean, I think if you're a healthcare worker or not, COVID has had us all feeling just a little uncertain, scared, sometimes just a little anxious. So, our employee well-being has been top of mind, and it always is, because healthcare is a stressful job in and of itself. So, we have a couple different things that I would mention. One, we have a Facts Over Fear website, and on there we have very specific well-being opportunities that our staff can tap into. everything from employee and clinician assistance to spiritual care to wellness. One of the things that is most important, I think, for our nurses to know is we do have the opportunity for them to meet with an independent nurse if after a really tough shift they need to decompress, to talk about things. They obviously always have their manager to talk to or our internal employee assistants, but they can talk to someone external. And that's been really widely used. I've been watching people that have been able to link into that and have been getting great feedback that it was really valuable for them. The other thing is not just us being able to take care of our employees, but watching our employees take care of each other, just the sense of family. We always knew we had a strong Sanford family, but they created a Recognizing You page, and it's really stories that highlight the amazing work and small acts of kindness that are happening just across our footprint, really. And it's neat. I was on there last night just reading through them, and it just really makes you feel like we're not in this alone, that we really have a family and everyone is there lifting each other up and supporting each other. And then beyond the emotional support that's needed and the physical support, the financial support is I mean, very obvious during this time. And I was so proud for Sanford to be able to step forward with our family stability plan, to offer our employees that, as well as our employee crisis fund. We have raised over $1 million through our employee crisis fund and have been able to give out money to over 650 requests. So that's been really neat. And over 4,000 hours of PTO have been donated. So our employees have really stepped up for each other too. And that's just a tribute to the sense of family we have here at Sanford.
Yeah, absolutely. As you were talking, I was thinking to myself that, your nurses, in addition to all of the caregiving that they already are doing, probably are finding themselves having to step in a bit, even for family and friends who can't come be there to visit these patients. So it's really taking on this additional role. And without putting you too much on the spot here, are there any things that stood out as you were reading through that website that maybe were particularly little uplifting stories that you might like to share?
Yeah. I think the one thing that has impressed me the most is our ability to navigate the change during this time. If there's one thing that's been constant, it's just been the change. And I think at Sanford, we're really good at change. But this virus has forced us to all work in ways that we never have thought before. The resiliency and just dedication of our employees and nurses, doctors, environmental services, frontline, non-frontline people has just been incredible. One of the things that has been just so unnatural for us is to have to put in our visitor restrictions. And so I think our communities understand why we've had to do that, but and it's really been a necessity, but it's just not natural for us. And so to answer your question, our nurses have really had to not only care for those that are coming into to our facilities and they're sick, but have really had to be that bridge between the patient and their family members. So beyond the usual cares and nursing functions that they're doing, I see them trying to hook up iPads and talk to their family and bringing notes back and forth and trying to be that link of communication because we know that support is so important. And I think more than ever, our nurses have just stepped up to really hold our patients' hands and to be that link with them and their families during this difficult time.
Is there anything you might suggest that we do, and I think about not just nurses, but, anyone who knows someone in healthcare, maybe it's your relative, your friend, your neighbor. Is there anything that we can be doing as that bigger support system that would be helpful?
I think healthcare workers are pretty resilient people. I get asked a lot, what can I do? My neighbor's a nurse. What can I do for them? I think the small little gestures and acts of kindness go a long way. Mowing their lawn, bringing them food. But really at the end of the day, I always say just the simple thank you for what you do. I think warms everybody's hearts and just puts a smile on people's faces. And I think it's really that simple, Jody.
I think we are going to see, and we continue already to see this, but some interest in the nursing profession and healthcare professions in general. Where are you at as far as beginning to work with new nurses? Summer's a big time for that. I know there are always a lot of students coming through your organization. Are you still bringing in those student nurses? Are you still hiring new nurses? What does the future, immediate future, would you say, look like as far as that's concerned?
Absolutely. I would say even through all of this, our relationships with our schools and our recruitment efforts around nursing have not taken a backseat at all. We continue to actively work through that. We've been tried to be very supportive with all of our academic partners as their senior student class has had an interesting last semester here with having to do things virtually. But we do expect over 400 new graduates to be joining us this summer. So we're looking forward to getting them on board and being part of the Sanford family. We also have internships, a couple hundred or so nurse interns that will be with us this summer. So none of that has really taken a backseat to this. This is what a great experience for them to be in the profession during this sort of time, and we can use them, and it'll be great to have them with us.
Let's just hope it's a one-time occasion in everyone's career, right? No matter which stage you're at.
Right, exactly. You know, I don't think anybody expected to be going through the COVID pandemic. No one ever imagined it, and even though it's exhausting and really leaving some people a little raw, I do think the nursing profession is going to look back on it though and find the good in it and how it shaped them as a nurse and made them better. I'm pretty sure this year will forever shape who we are as nurses and even shape those who we're aspiring to go into the nursing profession. They've gotten a front row seat, I should say, on what life really looks like. And I hope that if anybody thought this was their calling, they go for it and make nursing their career.
Good note to end on. Anything else you'd like to add before I let you get back to work?
You know, I just would like to say thank you to all of our nurses across the country, across our region, of course here at Sanford, but they've really been dedicated to their profession. They've been creative and collaborative in ways that we could have never imagined and really stepped up to support our communities, our company, and each other during this crisis. And I couldn't be more proud than to say I'm a Sanford nurse, and my deepest and sincere thank you to everyone out there for the work you're doing. It's unbelievable.
Perfect. Well, thanks for all you do and all your team does. Keep it up. We absolutely will keep in touch and continue to wish you all the best here in the days and weeks ahead. Again, Meghan Goldammer, Chief Nursing Officer at Sanford Health. It is National Nurses Week. If you know a nurse, if you know anybody in healthcare, it's always a great time to thank them, but a particularly timely way to do that might be this week. Do stick with us tomorrow, Friday. Hard to believe how fast these weeks go anymore. We've got a special live fun video look for you. I don't know exactly what time we're doing it yet. It'll be sometime in the afternoon, but keep checking our Facebook page for that one, and we'll post the recap over on our website as well. You can also view this video in replay over at siouxfalls.business. As always, thanks so much for watching.